If you're passionate about making healthcare better but feel the system needs to change, you'll love this podcast called Heartline: Change-Making in Healthcare. It's hosted by Dr. Andrea Austin, an emergency physician who advocates for physician well-being. On Heartline, Dr. Austin talks with healthcare leaders who are rethinking the status quo, tackling burnout, improving medical education, and shaping a more sustainable future for the profession. Find links to Heartline at healthpodcastnetwork.com/Heartline. That's healthpodcastnetwork.com/Heartline.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Welcome back to Healthcare for Humans. This is part one of a two-part series that explores what change actually looks like when communities lead the way. As I record this, the headlines remind us of something we know too well in healthcare. Trust is fragile. For many communities, immigrant families, communities of color, those who've experienced medical trauma, walking into a clinic requires courage. That's the reality that makes our conversation today essential. Because while systems struggle with trust and access, there's another story here. One of communities that have been building their own solutions for decades. Communities that understand healing in ways our textbooks never taught us. Today, we're traveling to Stockton, California to meet Little Manila Rising, an organization born from demolition equipment and developers' plans, now transformed into a beacon of community-led health innovation. The history is in 1999, two college graduates returned home to find bulldozers positioned outside the buildings that housed the largest Filipino community outside the Philippines. This was Little Manila, where the hands that built the agricultural empire of California once lived, where the United Farm Workers movement took root, where history was being erased one building at a time. It wasn't just historic preservation. They built it into a new model of health, building it from the community. One that understands asthma isn't just about inhalers, it's about air quality. That mental health isn't about just therapy, it's about belonging. That wellness isn't just individual, it's collective. You'll hear from Hannah and Tessa today, two of the organizers who work with Little Manila Rising. They'll share how their Echo and Healing PUSO programs bring acupuncture and blood pressure screenings to the same room. For those of us working in hospitals and clinic, this conversation offers something that shows us what our patients are building when they leave our exam rooms. How can we support this work that communities are already doing to heal themselves? That's what I want to ask yourself. So as you listen to Hannah and Tessa describe their health clinics and healing circles, know that people are doing this all over the country, all over the world. I want you to think about your own sphere of influence, the patients you see, the colleagues you work with, the systems you navigate daily. What would it look like to meet people where they are? So when you're talking to a patient, you're talking about that organization that has supported their family members and referring them to it. Not just theoretically or abstractly, but building real relationships in the community. Little Manila Rising, the organization that we're focusing on today, has spent 25 years answering these questions. Today, they're going to share what they've done. Here's Hannah and Tessa. Thank you so much for joining us. I think it's so great to have you all here to talk about the work you're doing, because it's incredible to just read about it and how you've been able to focus on a specific community and show up for the community in the way they want and improve their health in so many different facets. Let's start with talking about Little Manila Rising, about what that is, how it got started, and the community.
So in 1999, two newly graduated college students, Dr. Don Mabalan and Dylan Delvo, returned to Stockton after learning about the significance of their hometown to Filipino American history. And they literally found demolition equipment in front of the buildings of what remains of the Little Manila community, which is the largest population of Filipinos in the world outside of the Philippines from the 1920s to the 1960s. And they figured that someone should do something about this, so therefore they started Little Manila Rising. The work of the Manongs and Manangs would establish agriculture as the largest industry in California, and they would fight injustice, forming farm labor unions and creating change for acts that would be considered inhumane today. And their activism would lead to the establishment of one of the largest social justice movements in American history. And the joining of the Filipino Farm Labor Union, led by Larry Itliong, and Mexican Farm Labor Union, led by Cesar Chavez, formed one union, the United Farm Workers. Much of Little Manila was already destroyed in the early 1970s by the building of the Crosstown Freeway. And like other neighborhoods of color throughout America, decision makers built a freeway through it, destroying family homes, businesses, community centers, and much more. And fast forward to 2001, they rallied and the community together to have the designated site named as the Little Manila Historic Site. And in 2002, they dedicated the historic site and unveiled the banners. And in 2003, the city of Stockton named the area a commercial redevelopment zone with a developer who planned to tear everything down in order to build an Asian-themed strip mall. And the plan was to destroy 8 square blocks that consisted of family homes, businesses, churches, other nonprofit orgs, and other historic buildings of Little Manila. And so with only 4 months to respond with a counter proposal for redevelopment, Little Manila activists got to work knocking on each door of every person in the affected area and invited them to be part of envisioning what they would like to see in their community. The story became an international story, leading the city to receive the most letters ever written against the city proposal. And the exposure allowed a like-minded smart growth developer that saw adaptive reuse of the historic sites as a benefit of the development plan. In October 2003, Little Manila submitted their counter proposal to the strip mall development. In the end, the city chose neither proposal and did not move forward with the redevelopment of the area. But Little Manila viewed this as a victory. And since then, we've vowed to historical preservation. And what we're going to go into later is the various programs that Little Manila has gone into ever since that.
A lot of our work is carrying the legacy of our ancestors before us, including Dr. Don Buhulano Mabalan and our Manongs and Manongs. When I think about our work, I think of our work as like spiritual work. Like this is heart-centered work that's driven by our ancestors. Our ancestors dreamed for us to go into these spaces. So you'll notice like when you meet our staff, we all have like deep personal connection to the work that we're doing. We're doing it for our communities. We're doing it for our ancestors before us and to create a next generation of leaders.
That's awesome. I wonder if you could define that for us.
Yes, they are the elders in the previous generations, like the 1920s and 1930s. A lot of them immigrated here so that they could go into agricultural and farm working labor.
And it's from a dialect in the Philippines called Ilocano. So Manong is like older brother and Manang is older sister.
Thank you. I'm thinking about how urgent it must have felt with these redevelopment happening in the community and the will it took to organize in the way that Dawn and others did to ensure that the legacy in the community wasn't lost. Because I was reading some more details about it, and the plan was confusing of what would happen to the people that were living there, right? They were just like, we're going to build this, and then good luck to everybody else to find another place. And I think a decimation of what was, as you noted, the largest Filipino community out of the Philippines. So I think this is helpful to set the context of one particular place in time that had built a whole community and culture and was almost destroyed because of redevelopment plans. I think the history of Little Manila Rising is so interesting. And I know you're talking about this spirit-related work. So how would you talk about the mission of Little Manila Rising in this context? I know you talked about professional development, but you all do so much more. What are you all working on? What's your vision?
Our vision is to dismantle all these systems that keep our people unsafe and unwell. We definitely want to promote health equity through our environmental justice programs, mental health programs, health equity programs, youth development. When I talk about spirit-led work, I think about with Dawn. We didn't know that we would go into asthma mitigation and environmental justice work until she passed away in 2018 due to an asthma-related illness. None of us had a background in the medical field or in asthma mitigation work, but we knew that this was a direction that we had to take. Our community is depending on nonprofit orgs and leaders to make sure that we're changing the conditions in our communities and in the environment so that they could thrive, that they could have the tools to access culturally responsive healthcare, for example, and affordable healthcare. But when I think about our work as a whole, we really are trying to eradicate so many different barriers to accessing the care that we don't typically get, especially in South Stockton. I know that we have roots in historic preservation and raising awareness about the rich history of Filipinos in Stockton, but our directors were from South Stockton and knew that there's so much differences between South Stockton and North Stockton. There's not a lot of resources. There's not a lot of clinics, not a lot of access to fresh food, a lot of impact in over-policing and food deserts, for example. And so our main focus is to uplift the South Stockton community and make sure that we're creating resources, programs, and policies to advocate for that region specifically.
Well, we have a lot of people who are great clinicians and healthcare professionals who still think of healthcare as something specific, of something that happens in clinic and hospitals. You brought up the story of Dawn, and then you went into environmental justice work. And some people may say, why are you doing that? That's not related to asthma, really. Can you all speak to how is it connected to health and healthcare?
Well, for me, bouncing off of what Hannah said earlier, our community-driven work focused on health equity, climate justice, community reinvestment, and cultural preservation is very crucial when viewed through the lens of what Hannah mentioned, like the spiritual and holistic practices. And we recognize that this affects our marginalized communities in various ways. And for example, for climate justice and the need for clean air and great air quality, I see that as caring for the environment, and caring for the environment is often seen as a sacred duty for our people because, like we mentioned, Dr. Dawn's asthma attack could have been prevented from childhood if we knew of the certain measures to take with caring for our environment, and also from a healthcare perspective, coming up with that asthma mitigation plan from an early age and knowing how to educate her family earlier on so that way it doesn't have to carry on into adulthood. And that just emphasizes the interconnectedness between humans in our natural world of caring for our environment. Like South Stockton does not have a hospital within 5 to 10 minutes. Folks have to drive at least 20 minutes to the nearest hospital. And this leads to poor health outcomes because a lot of them face the barrier of transportation and also economic stability to even afford medical bills, to get to the hospital. So I think from a holistic perspective, this encompasses not only one's physical health, but also their mental, their emotional, and their spiritual well-being. And that altogether is interconnected with health and healthcare.
Yeah, I love that. I think we've heard that theme a lot across many communities we've talked to about the holistic nature of health, which I think our often westernized healthcare system doesn't do justice to. We focus on one part of it, which is often medications or these healthcare-oriented interventions when there's so much more to health than that. I think the second part that resonated with me in what you all are doing is this idea of nothing about us without us, that when it's created by the community, it looks different. Tessa, does that feel true? I feel like that's been a common theme too across the different communities we've talked to.
Yeah, definitely. And I wonder if Hannah and Quincel, you might share some of the way that Little Manila Rising addresses both the mental health and the physical health, for example, in the Echo project or the PUSO project.
One of the projects that we do with Echo and Healing PUSO is our health and healing clinic. We provide both physical healthcare services and education around diabetes, asthma, hypertension, and breast cancer screenings. And we also provide mental health education on adverse childhood experiences and trauma. And we try to link them to different services, including free therapy, for example, with Community Medical Center. We also make sure that we're honoring traditional modalities of healing. So we've invited a Hilot practitioner. That's a Philippines traditional massage therapy, for example. We've done acupuncture, sound healing, Reiki, which is energy healing. So we've incorporated different forms of wellness to meet people where they're at. And again, we have these clinics specifically in South Stockton because there's not a clinic nearby in the Southwest region. And when I think about these two systems, I don't think of them as separate. I think about them as interrelated, as they should be. And I view mental health as physical health, right? We shouldn't be treating them as two separate entities because in the Asian American community, we see that a lot of mental health distress becomes or manifests into somatic symptoms or physical symptoms, right? And they're least likely to ask for help, leading to more like delayed treatment and serious health conditions. So when we're taking that lens, it helps us to build our different programs and push for different policies, knowing that those two are intertwined, both like physical health, spiritual health, mental health, emotional health. For Healing PUSO, we are a mental health program that started about 3 years ago over the pandemic. Our main mission is to normalize mental health struggles and increase access to holistic health and healing. Some of the opportunities that we offer in Healing PUSO are wellness workshops at the local community college, San Joaquin Delta College. Those happen on a monthly basis where we talk about self-care, anxiety, mental health, and wellness. We also have culturally rooted healing circles where we partner up with the Filipinx ceremonialist who I went to high school with, which is pretty cool. His name is Manong Medicine. And we also have healing arts work. So that happens 2 times a year, as well as our health and healing clinics. In partnership with Community Medical Center, we do adverse childhood experiences, screenings. We provide one-on-one social emotional support to the community and therapy referrals. And an exciting thing is that we're actually going to be hiring a licensed clinical social worker to provide therapy to the community. Everything is free. So all of the services that we provide, the programs, and our one-on-one social emotional support is completely free to the community just to break the financial barriers to accessing care. In a short summary, that is what we do as Healing PUSO. And PUSO is also an acronym for Filipinx Uplifting Self and Others. It's also translated to heart in Tagalog. A lot of our work is heart-centered, spirit-led, and paying homage to our ancestors before us.
That's really remarkable. I love that it has a meaning in Tagalog of heart. That's kind of how I would want my healthcare to look like, to feel cared for by whoever it is I'm seeing. Pincel, did you want to add anything?
Oh, yes. So our other program within the health equity domain at LMR is called Echo. So Echo stands for Equity in COVID and Health Outcomes. And Echo was born out of the pandemic. And throughout the pandemic and beyond the end of the federal COVID public health emergency declaration, we've facilitated vaccines for marginalized populations, and largely for communities of color in areas with limited access to healthcare. And as Hannah mentioned, we're very intentional about where we host these clinics, as we recognize Southside doesn't have access to quality healthcare compared to Northside and other neighboring cities in our San Joaquin County. And since 2020, we've hosted over 50 comprehensive clinics in South Stockton with our local healthcare providers from Kaiser Permanente, community medical centers, our local general hospital, and even collaborating with our California Department of Public Health. We were part of the Vaccinate All 58 programs for the whole state, and we were able to bridge that gap of the healthcare system and our community members, because oftentimes a lot of our work was debunking myths and misinformation about the pandemic. As Hannah mentioned earlier, we offer free health screenings like checking A1Cs, blood pressures, and a lot of our work was trying to help our community with referral pathways with, for example, to see their provider about a concern that they've had for a while. And more recently, we got into addressing the opiate epidemic. And through that, we've been helping folks with getting access to medication-assisted treatments and also handing out free Narcan because we wanted to promote that it's safe to use and also how to use it so that way we can prevent any further opiate overdoses. So yeah, a lot of our work is interconnected, as Hannah mentioned.
That's incredible. What do the people who come to these two programs say about the contrast between what you're offering and, let's say, a traditional healthcare system? I know you mentioned there's some collaborations happening too, so I don't want to say it's either or. But when people show up, what do they say to you of what their prior experiences were and how they're experiencing it now?
I think after they experience, for example, like the massage therapy, acupuncture, the sound healing practices in relation to Western medicine, because they'll get access to both Western and traditional medicine practices during our clinics, it widens their eyes to the benefits of both and also recognizes that it's not a one-size-fits-all thing. Like if one person got a massage and for the other person it didn't really work, but the sound healing really allow them to ease their anxiety and their burdens. It just works differently for everyone. And overall, I've heard that it has improved people's health outcomes and promotes overall cultural diversity too. We recognize that not everything works for one person. And both practices promote physical activity and mindfulness practices rooted in both traditional and Western knowledge.
And one thing I wanted to add is a research study that really shaped the Healing PUSO program. Dr. Joyce Javier, she's a Filipina pediatrician in the Children's Hospital LA, and she did a Filipino family health initiative in response to the high rates of suicide ideation among Pinay teens. So it was like 45.6% of Pinay teens had suicide ideation. And she was finding that these patients that were coming into her clinic or the hospital were having a lot of mental health struggles. That was the first person that we reached out to talk about this Filipino mental health initiative that we were starting because we wanted to partner with her and do intergenerational parenting classes to teach Filipinx kids how to cope with their emotions and how parents could support their children to promote intergenerational wellness. And so we kind of use that framework to help us build Healing PUSO, making sure that it's driven by the community and for the community. So like going back to your point about nothing about us without us. And that's what really makes us different. I know that doctors can be really busy and their schedules are just seeing patients for 5 minutes, right? And that makes it really hard to genuinely make a connection and a relationship with a community member or patient. And what makes Little Manila different from what I've heard from other people and what we intend to do is that human-centered piece. So really making sure that we're there, seeing them not as a number, not as a statistic, but as a human who has complex struggles, who may be struggling with mental health, who may be undocumented, who may be a caregiver to somebody who has a chronic illness, right? There's so many layers to a person and so many deeply rooted struggles that may be a consequence to environmental inequities or health inequities, right? And that's something that we all really love about working at Little Manila Rising. Like, we want to meet people where they're at. We want to make sure that we're addressing all the different barriers to care. And something very unique about us is we also want to use their voices and their stories to directly impact our programs and impact local and statewide policy. I think that's something that was brought up earlier. How do we make sure that we're centering the voices of our community? And it's doing these town halls. It's having these panels, having these focus groups, hearing from the community, and using that to advocate for institutional change and long-lasting change. And that's what really makes us different.
I love that. Some of the concepts that we talk about can feel so abstract about centering community. Like that phrase, centering community, we say it so much and then it becomes buzzy, right? Like people are like, oh, we're centering community. So I love that your focus is that. And I want to just ask a follow-up question to make it real for folks of what has that looked in the most recent example, where you listen to the people that are coming, you change something about your program in response and advocated for something policy-wise. Is there any tangible example so people really understand what that feels to center community voice?
I think more recently, as Hannah mentioned, we had a town hall a couple weeks ago where we involved our local behavioral health services, our local health jurisdictions. On top of that, we included the other two panelists were community members living with asthma. And also, they're also seen as trusted community leaders within their community. So through that panel, we learned that some folks want to seek therapy, but don't know how to access. So therefore, the clinician that works at behavioral health services was able to answer the community members' questions and has encouraged her to seek group therapy again and also individual therapy. And just through these safe spaces that we've created for a community, we're able to conduct quality community forums, soliciting feedback through not just our town halls, but we've also had listening sessions where we had a Spanish speaking only focus group where we learned from our Spanish community. And also we developed this community needs health assessment that we disseminated throughout South Stockton to learn about our community's greatest needs and what they see as a priority in the community. So for example, they would like to get greater access to mental health. They would want someone to help them address their food insecurity issues. And going back to the earlier question, it just reminded me of not just with the holistic practices, but also being evidence-based in our practice and making sure that we promote something that is factual and we've seen the efficacy in it. And on top of that, the cultural competency aspect is like recognizing and respecting our community members' cultural beliefs and practices, I think is really essential for providing effective and quality healthcare with healthcare providers who understand this and can better serve their patients from diverse cultural backgrounds. And the understanding of the various cultural beliefs can influence someone's health behaviors, their treatment preferences, and even adherence to medical advice. So just a mix of genuine community engagement, one-on-one or in group settings.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have two quick requests. One, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. Two, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.